It's 9 o'clock. Good morning. This is Broadcasting House. Hello, I'm Paddy O'Connell. The headlines. Boris Johnson's ordered a 4-week national lockdown in England from Thursday. Pubs, restaurants and non-essential shops will close. The furlough scheme is being reinstated. Well, let's turn to some medical briefing for you. We have business and we have politics for you to come. First, we meet Professor Tom Solomon. He's Director of the UK's Emerging Infections Research Unit at University of Liverpool. Hello, Professor Solomon.
Hello.
The estimates of 4,000 deaths a day without action, which have clearly acted to galvanise Downing Street. Do you recognise that figure?
Yes, this is one of several modelling studies which have looked at what will happen if we don't do anything more. And the estimates of deaths range from 2,000 to 4,000 by mid-December. And we're seeing cases going up every day in the hospitals, and we're seeing more deaths, sadly, in the hospitals.
And the deaths are baked in. And this is the point. But treatment is very different. Very much fewer people are intubated. There are drugs which assist. So really, it's a different sort of patient than it was in March.
Yes, we now have a much better idea of treatment. We have this drug dexamethasone, which a large study across the UK has shown that this reduces the death rate by about a third. And in addition, rather than ventilating everyone, putting a tube right down into their lungs, we now know that for a lot of patients, we can support their breathing in a different way. But we still need hospital beds to do all of that. And if no action had been taken, then we will run out of hospital beds. And it's as simple as that.
Stay with us, Professor. Let's meet Dr Margaret Harris. She's helped us on BH on many a Sunday morning from the World Health Organization. Welcome back, Dr Harris.
Good morning, Paddy.
Your task, if you would be to put the UK in a list of 10 countries. Can you tell us the death rate, the number of people who are currently getting... Well, let's do the cases per 100,000. Where is the UK on a list of neighbours?
Oh, goodness. I don't actually have a top 10 there for you, so I'm not so useful. But it is well up there. And what we're really concerned about mostly is the percentage change. What is the intensity of the change? And what we're seeing very much with the UK and many of its neighbours, we're talking France, Italy, Spain, is that is increasing and increasing considerably. So that's why we really raised the alarm last week, talking about a 30% increase in cases, new cases last week, in that week on week, and a 40% rise in deaths.
So let me apologise to you because I've caught you out there a bit, but I've got the list, and I was under the impression we were sharing it together. So let me just answer the question just as a point of briefing. Belgium currently tops the list as 3,423 incidents of coronavirus cases per 100,000 population. The UK is 1,448 behind Switzerland, above Portugal. Is Europe now the centre of the pandemic?
We're looking at it as the epicenter because of the intensity of the rise. Now, the USA is reporting a very, very large rise as well. I mean, they had record numbers over the weekend and most days last week. But Europe, we are seeing such an intense rise that indeed we're considering it the epicenter.
OK, let's turn to Dame Deirdre Hines. She was Chief Medical Officer for Wales and led a review into the UK response to the 2009 flu epidemic. Welcome back, Dame Deirdre.
Hello, Paddy.
Let's talk about the lockdown reaction. Is the UK doing exactly what France did before?
Well, I'm not sure about that. I'm quite sure that the UK is now doing exactly what it should.
But late.
But belatedly, yeah.
So if we look at the reaction here, are you confident that you can answer the question, will it reduce deaths? Will it reduce hospital admissions?
Of itself, it should do both, but it's got to be seen as essentially a holding reaction, a holding position. WHO said that the only real effect of a lockdown was to allow time for more effective public health measures to be taken. And I see this as an opportunity to get in the UK once more an effective test, track and isolate mechanism in locally based into action together with the new tests, the more rapid tests that are in the pipeline, and then eventually a vaccine.
And can that be done in 28 days?
Well, I think that's the question. I think that we've got to hope that at least some elements of that, and of course the more effective drugs for treating are already known. So I'm hopeful that at least some good will come of this.
Okay, and on the question of where the reaction will come from, can I ask you, Professor Solomon, if you think we're just entering rolling lockdown, we aren't curing the virus, we are suppressing it. So do we have to brace for another lockdown in January?
I think what will happen over the next 28 days is the number of cases will plateau. This R rate, which is showing how much the infection is increasing, will plateau. The number of cases will plateau. And so we will be protecting the hospitals from being overwhelmed. But also what we need to do to avoid further lockdowns is we have to have a much more effective test, trace and isolate system. And this is how countries in Southeast Asia have managed to get on top of this. So if you can very clearly identify who's got the virus because you've tested and traced and isolated contacts, then you get the outbreak under control. We had that in the summer, and then we let it go again, unfortunately, and that's why we're now having to reintroduce this lockdown. But many major countries in Europe are having to do the same.
Yes.
And it's partly because we're entering the winter and viruses do spread more easily at this time of year.
I'll pick the testing question up with Dr. Harris, but one more question for you, Professor Solomon. With schools staying open, with respect to the home nations which are currently where they're currently closing, but with the English schools staying open and the colleges and the universities, and with the Office for National Statistics reporting infections are steeply increasing in secondary school children, does that decision take a directly different course for this lockdown than the one seen that began in March?
It does mean that side of it means that it will be harder, but the difference is we now have more testing and tracing and isolating than we did in March. So hopefully they will balance each other out. But clearly it would have been preferable to do all of this over the half term when schools would have been closed as well, because then the combined effect would have been stronger.
And that is largely what happened in Northern Ireland and in Wales. So let's turn finally to you, Dr. Harris. Slovakia has announced it's testing everyone over the age of 10. It will take 2 weekends. Are Slovakia leading? And is the warning that we've heard from Dame Deirdre correct that our test and trace system is not fit for purpose?
I'd certainly agree with Dame Deirdre that that's what's got to be focused on right now. And testing's important because it tells you who's infected, but the next stage is the really critical one, and that is finding everybody who's been in contact and getting those people to stay at home for the period of incubation of the virus, that's 14 days, and making it possible for them to do it. So ensuring that their workplace understands that they can't go in, that they can get all the things they need, because once you've been identified as a contact, you don't get to then be told 3 days, from 3 days now you have to self-isolate. You have to do it right from that moment. And for it to work, you genuinely have to self-isolate. So I'd say to your listeners right now, think about how you would do that in your own household if any of you become a contact. Ensure that you can really do that, because that is how this outbreak, this transmission will be brought down.
Thank you very much indeed. Live, Dr Margaret Harris from the World Health Organization. We heard Dame Deirdre Hines, former Chief Medical Officer of Wales, and Professor Tom Solomon, Director of the UK's Emerging Infections Research Unit at University of Liverpool. We'll have business reaction at 9:30 and political reaction just before 10.